From the studios of Boise State Public Radio News, I'm Samantha Wright, filling in for Gemma Gaudette. This is Idaho Matters. U.S. cattle face growing threats from diseases. As bird flu invades farms, a team of scientists are racing to slow the spread by developing the first mRNA bird flu vaccine for cattle. Could this be the answer to reducing the risk of animal-to-human transmission and to protect livestock? According to the attack on farms, the new world's adding to the attack on farms, the new world screwworm is advancing across the Northwest. The Animal and Plant Health Inspection Service has suspended importation of live cattle and bison from Mexico in response. And in other health news, a new study has identified a possible link between Alzheimer's disease and the cold sore causing herpes virus. That discovery may be a crucial step towards developing prevention strategies and innovative treatments. Well, it's Wednesday, time for our Doctor Roundtable with Dr. David Pate, former CEO of St. Luke's Health System and co-author of the book, Preparing for the Next Global Outbreak. Dr. Pate, I want to say welcome back and thanks for joining us again on Wednesday.
Thank you, Samantha. It's good to be back, and I want to thank you and all the listeners for the kind support and kind words while I was going through things. So I'm glad to be back.
Well, we are really, really, really glad to have you back. We have gotten a lot of notes and comments and people who are just so glad that you're back today. So let's get to it. Let's talk about bird flu. It just keeps spreading in cows. We've got more than 1,000 dairy herds that have been hit. That is a big number. In 17 states, that includes Idaho. So tell us about this new vaccine that we're hearing about. What is this?
Yeah, so researchers have identified an mRNA vaccine that, when given to calves, protects them from the bird flu being transmitted to them through the mother's milk. Because as we've talked about before, when cows get bird flu, it has up to this point particularly ended up in their udders and produces very high levels of virus in the cow's milk, which is why we do not, which is one reason why we do not recommend that humans consume raw milk. But in this case, it seemed to protect the calves. Now, it needs further testing, but this is a huge advance, and it would be just one part of a number of pieces that would need to be done to contain bird flu, because the threat is not just from cows, but on the other hand, as you mentioned in the lead up, we have been now trying to contain the spread of this virus in cattle, in dairy cattle, since March of last year. So, and we're still not getting it under control. And Idaho's herds have been disproportionately impacted, or we're just detecting it better. So this is an important advancement. It's not a total solution, but the more we learn about these vaccines and how we can adapt them to stop these transmissions, is going to make our food sources safer. It's going to protect the milk supply. It's going to be a big piece of the puzzle of solving this threat.
Well, and as you said, this is just being tested. It's just been on calves, not on actual dairy cows, correct?
That's correct. So that would be the next step, to see if it can protect the adult cows, particularly the ones that are going to be producing milk. So that would be the next step.
And I also read in this story about the study, and we're going to put a link to that on our website, boisestatepublicradio.org, that there's a possible vaccine for for chickens, that would be huge. I know that part of the increase in egg prices over time has been because bird flu has gotten into chicken farms.
Well, and that's right. And it has been particularly devastating because in chickens, unlike cattle, the this form of bird flu is almost invariably fatal.
Mm.
And because of that, and because it kind of puts the chickens through a miserable death process, we tend to cull farms when there's a number of infections in their poultry, and because it just spreads so quickly and ends up killing so many of these chickens. And so then it affects, just like you said, the egg supply. But one thing, while we seem to be going off on this anti-mRNA vaccine path, the thing to remember is our typical technology for developing influenza vaccines is to use chicken eggs. But if the
Ah.
virus is killing the chickens and they're not producing the eggs, then we get into a real mess. So the mRNA vaccine technology is really important for many, many reasons, but could be key to getting us out of a real bad mess. If avian flu were to ever become adapted for efficient transmission in humans, most of us believe it would be quite a bit more severe than COVID was and probably disproportionately impact children.
So, not to put you on the spot, but if they decide that this vaccine for cows or chickens works, how long would it take before it would actually be available and working? Because we know that getting a new vaccine on the market is not an easy task.
Well, that's true. Uh, Fortunately, I think that the approval process for the animal vaccines would take a different route than the one that is now causing most of us to shake our heads with the human approval process. So it could be quite a bit faster. The other thing is the mRNA technology allows vaccines to be produced and modified much, much quicker. It can be ready in months compared to a year or more with traditional technology. So it really is an important key. I think if we were to put our mind to it, we could get this done. However, to your point, we saw the very depressing news that the federal government terminated a contract with Moderna to develop the avian flu vaccine for humans. We may be able to protect the animals, but it doesn't look like we're going to be serious about protecting humans. But certainly, if we can protect the animals, then we will lessen the chance that this is going to become a pandemic involving humans.
And that is always the scare, for sure, for sure. Let's stick with vaccines because we've got listener questions today. Lisa wrote, I last got a COVID vaccine in August of 2024, had COVID at the end of February of this year. I would like to get another COVID vaccine booster, but have heard I should wait a few months after having COVID. When is the best time to get a COVID vaccine?
So, in this particular case, first of all, you're right. Typically, we recommend waiting about 3 months after an infection before getting the vaccine, just because of how the immune system works and when is the best time to get a good response from the vaccine. We don't want to do it too close to the infection. Frankly, if this happened to be the time that the government was rolling out the new updated COVID vaccines, I would tell you now is fine. However, it's not. The time will not be coming until this fall.
Oh,
They will have an updated version. And depending on your age, if you are in a high risk group, and including elderly, then you could go ahead and get the vaccine that is already out. You could get a dose of that now. Then you would want to wait till probably around late September, early October to get your new updated vaccine when that comes out. But if you're not in the high risk group, and then you may need to just wait until the fall updated vaccine comes out, although there is some confusion about the guidelines that the CDC is going to use for eligibility of those shots. That Secretary Kennedy indicated they're tightening it up so that only those over 65 and with those with high risk conditions could get the vaccine. However, the CDC hasn't changed their guidance yet, and that determines what covers the vaccine from the insurance standpoint. So I would say, unless you're in the high risk group, plan for this fall. But if you're high risk, you may want to go ahead and get a dose right now.
oh boy. Okay, let's take another question. Laurel wrote in and said, I am a patient that is high risk for respiratory infections. I take all precautions needed to keep safe. Wear an N95 in public. I need to have a dental exam and my teeth cleaned. Do you know of any dentists who are safely treating a patient such as myself? Fortunately, my other medical providers wear N95s and take my situation seriously. Laurel wants to know how to find a dentist.
Yeah, you do have to do some searching. Unfortunately, I wish more doctors' offices, hospitals, dentist's office were using some really fairly simple measures to greatly decrease the risk of infecting you during your visit or during your care. However, a lot are not. Now, with that said, there are some that are, and one way that you could locate those dentists is to just search for COVID cautious dentists. That's CAUTIOUS, cautious dentists. And you will find some practices. Now, what you'll want to do is call their offices. There's a mistaken impression that the pandemic is over, that COVID's not a big deal anymore. I think we're in for a rude awakening because that's not true. But you might want to check to make sure they're still using these enhanced practices. If not, I have been advising some immunocompromised patients about some other things they can do, including seeing if you can work with the dentist to get a first appointment of the day so that you're in there before other people are, and adding a virus to the air. Also, there are portable devices that you can take with you, and you might check with the dentist if they would allow that, personal air purifiers and units. And also, there are some small portable far UV light sources that you can get and take with you. So check the internet, but then call the office and verify that they're still using those precautions.
Very good advice. Very good advice. And let's take another listener question. This listener wrote in to ask that they heard secondhand from an employee at the CDC in Atlanta that at this time, no one there is working on the flu shot for the fall. Does this sound right? They ask. Isn't this the time of year we look to Southern Hemisphere to see what strains or variants are coming in order to prepare our fall shots? Do we know anything about this?
We do. And so that was a great observation by that listener. That is exactly correct. We do look to the southern hemisphere that is going through their flu season now to see what are the specific strains that are causing disease, how severe is it. We're getting some early indications that this may be another severe flu year for us, so it is important that people really strongly consider the flu shot this fall. But what you've heard is kind of correct in that we have withdrawn from the World Health Organization, or we're in the process of doing that, and part of that is on the flu strain selection. However, the World Health Organization has already met and has selected the strains. We almost always agree with their selection, and so in this case, even though we are taking a much reduced role in that, we still will be prepared because the vaccine manufacturers will go with the World Health Organization recommendation. And so do not fear, we will have flu shots, but that's the explanation for why you're hearing what you heard.
Gotcha. Jan sent us this question. I have heard adults should get a blood test to determine whether they have had the measles when a child and need to get the vaccine. What are your views on this? This is actually an interesting question. For some folks, maybe if they got it when they were very, very young and don't remember and don't have anybody to ask, how would you know?
Right. So there's several approaches to this. First of all, if you are in my age group, that is, you were born before the end of the 50s, you very likely are protected, even if you don't know whether you had measles or not. If you were born after in the 70s, you are very likely vaccinated. But if there's question and you can't find the answer, you can do a couple of things. One is you can get a blood test to test your immune level to measles. The other thing is, if there's really a doubt, you can just go ahead and get revaccinated. It's very safe. It's easy to do. And so you can do either way, get the blood test. Of course, that usually costs some money and you have a wait. Or if there's a concern, especially if you're a big traveler, have plans to go travel internationally, you may just, if you're not sure and there's doubt, you may just want to go ahead and get the vaccine. But either approach can be done.
Gotcha. Okay, so on May 11th, the USDA stopped cows from Mexico from coming into the U.S. over concerns about the rapid spread of the New World screwworm. It's really hard to say. Dr. Pate, I have never heard of this. What is a screwworm? And for anyone eating lunch right now, we'll try not to get you too grossed out.
All right, we'll try our best, but
but be careful.
Well, first of all, before everybody loads up on ivermectin, the screwworm is not a worm. So the New World screwworm is actually a fly, and why it got its name is a bit tortured and might require me to get a little gross here, but it kind of acts that way, but it's a fly. And what happens is these flies that are in Central and South America, they have at times been in North America, and in fact the United States went through a big eradication process that took us a couple of decades to rid ourselves of it, and we did rid ourselves of it. But now these new cases, which I first heard about in November of last year, the first case of the screwworm being identified in Central America, but it is kind of gradually moving up and towards the north, and that is what has caused concern on the part of the United States, rightly so, to try to contain it and not let these flies back in to the United States. So what these flies do is they are attracted to cattle, and particularly, but also certain other animals, particularly animals that chew their cud, like, could be bison, horses, others as well. Some pets can get infected. Rarely, well, I would say at least not very commonly, humans can be directly infected, but particularly like warm-blooded animals, and these flies are attracted, particularly if there's any wound where there's a break in the skin. They are attracted to those spots. They deposit their eggs. Those eggs become larvae or maggots, and the maggots do kind of have a worm appearance, and they basically do screw themselves in through the skin into the body of the animal, particularly taking advantage of that wound. So we can identify that, and so we can spot it. It doesn't require tests, it just requires an examination. We can spot when that is the case, but of course then what we do is remove those the screwworms, and we send them off to the lab for confirmation. The real danger is when these screwworms don't go in through a wound, but actually go up through a mucous membrane like the nose, where it can, that in those cases it can actually be fatal because they can obstruct the breathing and so forth. But this is a big problem. We don't have a treatment for human infections. We don't see many human infections, but it is certainly a risk to our food supply and indirectly to humans if we don't contain this. And I think this is one example of very few lately where we are taking the proper steps to protect people from the spread of this.
Well, it's fascinating, and I appreciate you giving us an update on what it is, and the fact that we're trying to keep it out and keep it out of our cattle, as you said, out of the food supply. I want to talk about a new study that's looking at a possible link between herpes and Alzheimer's disease, and this looked a little technical, so I'm hoping, Dr. Pate, you can break this down so we can understand it.
Absolutely. This is very, very exciting news. I will say that what led to this research is that in general, we are now finding more and more evidence that sometimes it is prior viral infections that can increase our risk for various neurologic diseases. Probably the most well-documented and recent development was the establishment of Epstein-Barr virus infection as a risk for the development of multiple sclerosis. We've also found some evidence that we're pursuing to see if there is a cause and effect of certain viral infections and the development of Parkinson's disease. In this case, these researchers looked at the abnormal proteins that we find in the brains of patients with Alzheimer's disease, particularly a protein called Tau, T-A-U, and the Tau protein, we have been studying that for decades, trying to figure out whether that is the cause of Alzheimer's disease. And what these researchers did is they looked at these brains and identified the tau protein that typically is within cells of the brain. And what they identified was viral proteins from the herpes simplex 1 virus that is commonly implicated in cold sores. And so now, that's an association. That's not necessarily cause and effect, but it is of note and could be a cause for concern. So they did further studies where they looked at experimental models where we cause the herpes simplex virus 1 infection and study its effects on the brains. And what they saw is that when this laboratory model where you caused infection, the cell responded to the infection by producing the tau protein, and then that protein actually evolved in a way to become abnormal. And it appears from this study that the production of the tau protein may be part of the brain's immune defense to viral infections. And so it may serve a purpose at the time of infection, yet persist and cause a problem later in life, specifically with the development of Alzheimer's disease. So we have a lot more to figure out. Unfortunately, we're making so many of these advancements in our understanding, but right now, research funding is being pulled back so severely, it is going to hamper our progress in these fields. But this does lay the foundation for us to do more testing to see could we decrease the incidence of Alzheimer's disease by treating herpes simplex virus 1 more aggressively using antivirals? Could we prevent it altogether with vaccines against some of the herpes viruses? These have been problematic, but it's an area, there's a lot more area for exploration, but this is kind of consistent with a growing body of knowledge that many of these neurologic diseases, particularly neurodegenerative disorders, they may have a basis in either cause or putting us at risk for the disease based on prior infections. And of course, that's why I've cautioned through the COVID pandemic, don't just focus on death. There are consequences to infection. We don't know what those are necessarily for COVID, but let's be cautious about it. And of course, we have been learning more and more things that can happen as a consequence of infection, even if it's not a serious infection or you don't die. But also, during COVID, what we have found is that some patients, particularly those that seems like that develop long COVID, may have a resurgence of their herpes simplex viruses that they are previously under immune control, but then you get this infection and those we've detected reactivation of those infections. And so that is leading us to concerns that what we may see following all of these millions of COVID infections is that one day we may see an increase in dementia and maybe even particularly Alzheimer's disease. So this area of research is very important where we don't have enough to put all the pieces together, but we are getting more and more pieces and having some concern, but that those concerns then offer us an opportunity to develop treatment strategies that might be effective now.
Wow, that's really depressing. Especially when you talk about possibly more people getting Alzheimer's in the future, perhaps in response to something like COVID. Just the number of people with Alzheimer's now is out of control, and I just can't imagine more. That is crazy. There's another study out there. We can't get into it right now about you talked about not necessarily cause and effect, but there is a study that was looking at whether the risk of Alzheimer's drops when patients with herpes use herpes medications. We'll make sure that that's in the link that we're going to put on the website, boisestatepublicradio.org. But we're going to have to wrap up here. And I want to say a very big thank you to Dr. David Pate for all the time that he's given us today and given us forever and will give us in the future. Dr. Pate, it's really good to have you back.
Well, thank you, Samantha. It's great to be back with you. And again, thank you to you and your team. And thank you to all the listeners for the support as I've been transitioning in my own life here. So thank you so much.
Thank you. We have been speaking with Dr. David Pate. He's the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. If you have a public health question for our Dr. Roundtable, you can send us an email at idahomatters@boisestate.edu. We will answer it next week.
You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you were going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.